Good morning. Welcome to Village in Motion. Today is Thursday, October 8th, 2020. I'm your host for today. My name is Susan Gerhard, and I'm thrilled today to have as our guest Stephanie Mitchell, who is our new home care administrator. Much appreciated that you're here, and we've anticipated having you here at Green Spring. Welcome.
Thank you. I'm happy to be here.
You come to us from where?
Originally from Pennsylvania, but I've spent the last 16 years on the eastern shore of Maryland, managing home health companies in the states of Virginia, Delaware, and Maryland.
That sounds like a busy job. A lot of time on the road?
A lot of time on the road.
So you're ready to be a little closer to where you live?
I'm ready.
Every day. That's a good thing. So you are, your intro here says that you have a Bachelor of Science in Nursing and you're a registered nurse. And you said to me that you have always worked in the home health field.
Almost all of my career. I've been a nurse for just about 30 years and have been in the home health industry, either working as a clinician or a leader for just about that long as well.
It always fascinates me. We think of nurses as being, the people we see in hospitals or doctors' offices, but as we found with Melissa Robson, our Associate Executive Director, that nurses do a lot more behind the scenes that we may be aware of.
For sure. We wear lots of hats to keep many things going in our respective industries.
So you've always been in the home health field, which is great. We're glad to have you here to do that. I'm sure you will be kept very busy. So let's talk a little bit about, we use the term home care, which is made up of two parts, correct?
That's correct.
And those are?
Home health services, which when we talk home health services, primarily we're referring to those services that are covered in the home under the Medicare benefit.
Okay, so home, I'm going to get my copy of this slide here, and I'm sure that our team will be putting up the slide on home health. So home health is covered by Medicare.
It is.
Under what circumstances would someone have a home health person in their home?
There are a variety of reasons that someone would be eligible and would benefit from home health services in the home. Often it is skilled services after some sort of situation that put the patient or the person into the hospital setting. Mm-hmm. So if we think about hospitalizations, injuries, falls, a change in their medical condition. But we're also in the prevention business.
Oh, okay.
And so if you are having a medical change at home, one of our goals is to help people to manage that condition at home and prevent an unnecessary hospitalization.
And I think that's everyone's goal right now, to stay away from hospitals unless we absolutely need to.
Absolutely.
So that you could have an illness or something that you required a little more care than would come from the home support side, which we'll talk about in a minute. But home health can come in, and it's a situation where you might not need such skilled care as you would receive at Garden Ridge, correct?
That's correct.
So this is someplace in between really healthy, Garden Ridge, the hospital's over here, and here is where home health can help.
Sure. We are part of that continuum of care here in Green Spring, and our goal is to provide the necessary services in the person's current living home, and help them to remain at home, healthy at home as long as possible.
So what kinds of people work in home health? What is the background of the people who work there?
In home health, we're mostly dealing with skilled clinicians. So think registered nurses, licensed practical nurses, physical therapists, occupational therapists, speech therapists, and we also do provide some aid services in that certified business line as well. These visits would for all of the stated clinicians would be usually provided in a visit under an hour several times a week, either to teach the patient how to care for themselves or provide the necessary therapy services to improve that function.
My guest here on the program yesterday was from outpatient rehab, but the therapists who would come to your home would be coming there because you are not yet physically able to get to outpatient rehab.
That is correct. That is one of the Medicare eligibility requirements, that patients or people must have a difficulty in receiving care in a different setting.
Okay, so we're encouraging people to get up and get out as quickly as they can, but we're there to help them until they can.
Sure.
And I think in the area of home health, there is an assessment that can be done, that if I think, oh, maybe I need some help and I don't know what to ask for, a registered nurse can do an assessment.
Any of us in the home care business line would be able to answer specific questions that people have and point them in the right direction, whether it's services within our department or along the continuum of care here at Green Spring.
And this would be in combination with the person's doctors, correct?
Yes.
Yeah, it's not just that someone can jump up and say, I'd like someone to come and do physical therapy in my home. That referral needs to come from the person's doctor.
Sure, and we can help facilitate that if after a conversation with the person that we determine that would be a good fit and appropriate services for their condition right now, we would be happy to work with the physician to get that referral and those other items that are necessary for Medicare billing.
And these physicians could be either on campus in our medical center or a doctor out in the economy.
That's correct.
Yeah, okay, that's good to know. So I was looking here at your slides. A visit's usually 1 hour to perform the necessary skilled services. Now, skilled services would be what that would be different from less skilled services from the home support side?
Skilled services would require that knowledge and skill of a professionally licensed nurse or therapist.
Okay, that's good. All right, so let's look at the other piece of this. And the other part of your job is overseeing home support. And the difference between home support and home health is what?
Usually with home support services, we're thinking of those services that, as we all get older, may need some extra help doing, either caring for our home, bathing, dressing, medication reminders, sometimes just companionship.
A little food preparation?
Food preparation, any of those things that we need to do every day to just keep going on. These folks are able to come in and provide those necessary support services, again, to help us remain in our own living environment.
And I think I cut you off, and I'm sorry, before you used the word companionship, which is probably the most important piece.
Sometimes it can be just for companionship when, if we're alone.
Sure.
And lonely and wanting a little extra companionship, we can help provide those services.
And the home support people are trained, obviously. They are home. Their title is what?
We have companions, we have nursing assistants, we have caregivers.
But they are trained as what?
Not all of them.
Certified nursing assistants.
Yes, so
I was waiting for that to come into my brain.
So nursing assistants and all of the employees in the Green Spring team have been vetted and have the appropriate background checks and clearances to ensure that we're providing the best quality of services within the community.
And I think one of the most important pieces of that is that the people who are working for home support, if they spot something with the person to whom they're providing care, they're going to be able to come back to you and say, wait, I don't think Mrs. Smith is doing very well here. I'm thinking maybe she needs whatever.
Sure. We've been having a lot of discussion about how to funnel those services back and forth as the patient or the person's condition either improves or potentially declines in some circumstances.
So around campus I see a lot of aides who are not Greenspring aides. And the difference, the important part of having hiring an aide through Greenspring is that if you hire the aide on your own, you probably don't know much about the agency for whom they work, if they work for an agency. Many of them are independents who have not been vetted, and you really become that person's employer, which means you are responsible for taxes and paying for Social Security and all of these pieces. The price may sound good, but number one, you don't know what you're getting, and number two, you have a lot of liability as far as an employer there, correct?
That is absolutely correct, and something that a lot of people, aren't aware of. We are on campus and available and welcome questions, and we'll assist, our community residents in any way that we can. Obviously, we do have a continuum of care, and if home care isn't necessarily the right level of service for the person, we also do provide those outpatient services as well. And
are there times when you say to the patient, to the resident, perhaps Garden Ridge would be the place where you can get the more appropriate care?
Obviously, our goal in providing home care services would be to keep the patient or the person in their current living situation. At times, though, things decline, and the appropriate level of care would be Garden Ridge.
Okay.
On the other extreme would be that things improve and they would be more appropriate in outpatient. So it's really a great thing that we have the ability to provide any level of care here at Greenspring.
That's terrific. We are out of time, but there's one last point that I know you want to make, and that is that if I feel that maybe I need some assistance and I don't know what to do, what do I do?
Call me. I'm happy to talk with anyone about their particular situation and help them to get the appropriate level of care that they need.
And we have the number up on the screen for everyone to see. So yes, you have someone, either you or someone on your staff can talk through and say, this may be the right thing for you.
Absolutely.
Terrific.
Please give us a call.
Stephanie, thanks so much for joining us
Thanks
today.
for
We're
having
glad
me.
you're here at Greenspring, and we hope you stay forever.